Almost every doctor back in the beginning when we started working looked at hygiene as a lost leader. And we realized that there must be some way to turn this around and turn it into a profitable division. It was a clinical skill. It was critical to the success of patient care. And there was no reason this shouldn't be a profitable part of the practice. As I'm working with the doctor as the consultant, but again, I'm not clinical. And I don't know the clinical issues and how to judge the success of the program. I can judge the economic success very easily. That's because I can watch the production per day per hygienist. And I know all the expenses involved. I can show the increase in profit. But the clinical side of the game and all the issues that have to be tracked there, that's done by Advanced Hygiene Concepts. They take the time, they have the systems, the reporting that goes on for a year as part of their overall service to make this work in the practice. There's a good economic return when you're doing a complete analysis and workup for a patient for periotherapy. And that should not be discarded. We analyze it because it's part of our business. And we look at turning around an additional $75,000 to $100,000 a year in the average practice if they're putting in a good, therapy program. I mean, we've got doctors who put their 2 kids through Stanford based on hygiene program. And you just can't ignore that today. And we've tracked the results from over 300 clients that we've referred to Advanced Hygiene Concepts over the last 10 years. So it's a no-brainer for us to make that referral. A lot of them were really apprehensive when they first went into it. A lot of them go into it because we beat them up and say, you've got to do this. And every one of them, when they come out at the end of the 3-day period, has said, this was the greatest thing I've ever done. This is one of the few programs that you can say, okay, we're going to do it today, we're going to implement, we're going to get trained, and it's implemented right then and there. Your systems are changed in the practice. It doesn't start 2 weeks from now, it doesn't start 2 months from now. It starts the day they walk through the door, and from that point on, it's in place and working. Additionally, the thing I really like about Advanced Hygiene Concepts is the fact that they've got a series of regular quarterly, I believe it's quarterly, programs for training that they put on that new team members coming into the practice can attend. And I can show you, we've run over 300 practices through Advanced Hygiene Concepts. And we know the economics behind it. And it works. It works every day, and it works almost universally across the board.